The first thing is I want to make sure I hit some high points from this medical, legal, ethical issues here that I want you to know about and really understand. I know Captain McClanahan went over them, but I want to make sure I just reiterate a few points because I wasn't in there, just to make sure everybody's on the same page. So, expressed consent. So I want everybody to understand what that means. Express consent is whenever I walk up and I go, hey, can I take your blood pressure? Or, may I check your pulse? And then that person may just offer me their arm. They don't necessarily have to say yes or no or anything like that. It's consent at a yes in its most basic form. Now, there's another term that is really important that I didn't see on a slide unless I just missed it somehow, but that's informed consent. So let's use the blood pressure example. I walk up and I say, hey, I'd like to check your blood pressure. I want to see what your heart's doing and if you have any fluid imbalances. What I'm going to do is I'm going to take this blood pressure cuff and I'm going to wrap it around your arm. And then I'm going to put a stethoscope right here and I'm going to pump this blood pressure up while I listen for your heartbeat. It may get really tight, but it won't last for long. And then I'm going to slowly let that pressure off until I can't hear your heartbeat anymore. Is that okay if I do that? And then you look at me and you say, yes, you can. That is informed consent. Do you see the difference there? So I want y'all to really understand the difference between expressed and informed consent. Not necessarily for like scenarios and stuff during class. It's just those are going to be some test questions throughout our class as well as on the state that you need to be able to differentiate with. Consent's really important, so these terms also are important. Okay, so implied consent. So this is where you have someone who is unconscious or otherwise incapable of making a decision. We'll talk a little bit more about an assessment about level of consciousness and awareness and things like that. But, obviously unconscious, we're going to assume that they want us to do everything that we need to do to save their life or otherwise treat them. Now, when it comes to incapable of making an informed decision, this is where we're with small children without parental, parents, around. Also, this can be someone who's really drunk, really high, or they're having some sort of mental illness crisis where they are not able to appropriately answer questions about who they are, where they are, what year it is, what's going on, anything like that. So at that point, implied consent counts. All right, so again, this is when we're really doing treatments and stuff that with this implied consent that are life and limb. All right, really important treatments. We're not doing anything, kind of optional or anything like that. Okay, so if somebody isn't really hurt or doesn't do anything over the top, the implied consent would be us, taking them to the hospital if they're not with their right mind. But, if they're actually injured, we're doing everything we need to do to treat them to that point of saving life and limb. Okay, again, this could be, behavioral crisis, mental illness, several different ways like that. There could be power of attorneys, different things like that. Whenever it comes to power of attorneys, I know there's a lot of questions about, oh, well, how do I tell all of this? All right. They should have paperwork with them. Whatever paperwork they show you, it is up to you to take a look at it. If it's signed, notarized, look legit, you can roll with it. All right. Nobody expects you to be some power of attorney master. All right. If it looks legit and a reasonable person would say, yes, this is legit, then you use it. All right. If it looks like something written on the back of a napkin and everything's forged, then there you go. All right. I do want to show you, I'm not sure if he showed you or not, but here's the most in DNR policy here. So, I'm going to zoom in just a little bit. All right. So this is a policy within our protocols. All right. So this is whenever, kind of somebody's died. All right. So this is the whole policy that takes care of that. Next week in class, I'm going to give you the link. Y'all be ready to have this link to be able to look at this stuff. Okay, so this talks about sometimes when we have to notify the medical examiner. So that can be, you know, accidental poisonings, homicide, suicide, violence, you know, all these different things. No current primary care provider. Really, you're contacting the medical advisor or examiner, sorry, whenever there's not an expected death. All right, if somebody's on hospice care, there's already a physician that has agreed to sign their death certificate. If somebody has a DNR, do not resuscitate order, somebody has agreed to sign their death certificate. Specifically, that someone is the physician that signed the DNR. Hang tight 1 second. And we're back. So here is the DNR. This is going to come on, no, I don't want to buy goldenrod paper. Here it is, DNR form. This is what it looks like. Okay, so it's going to have an effective date. And then if there's going to be an expiration date, or they have to check this box here, if there is no expiration. Okay, so again, this is going to be on this goldenrod colored paper, which is pretty much just going to be the color that you see right here. All right, it's going to have the patient's full name. And then here is all of the physician information right through here, telephone number, after hours number. So for this to be valid, all of this has to be filled out appropriately, and all of this has to be legible. And here's kind of the key part. It has to be handed to you, the piece of paper. No pictures, no nothing. That piece of paper has to be handed to you, and it has to be intact, not taped in half or anything like that. Like, it has to be intact, ready to go. They are supposed to tell them at the doctor's office to like put this on their refrigerator. Some people listen, some people don't. So anything that's off with this, you continue CPR. If a family member grabs it and tears it up, you're doing CPR. All right. If they hand you this DNR and you're holding it in your hands and they say, no, you're doing CPR, you're not doing CPR. All right. This is what a DNR is for. That patient has chose that they do not want to be resuscitated. That is their right. This form is their consent telling you to let them stay dead. All right. So let's look at the most form. The most form is going to come on this pink paper that you see here. And this is what it's going to look like. All right, so this is a little bit more in depth. So what you're going to see here, obviously, patient's information, effective date. But this is where the patient is saying that, okay, I want you to either attempt resuscitation or do not attempt resuscitation. If that is the case, they will have a DNR that is alongside of this. Now, there's some other stuff here. The patient can choose that they want a full scope of treatment. You're not holding anything back. Or they can say limited. I'll go to the hospital, but don't put me in ICU. You can give me IV fluids and cardiac monitors, but don't intubate me, right? And then other, you can use other less invasive things like BiPAP or CPAP, which we'll talk about here a week after next. All right, and then there's also just comfort measures, right? Palliative care. Let me die comfortably is what that is saying for this one right here. Okay, whether or not to use antibiotics, whether or not to use IV fluids, feeding tubes, things like that. All right, and then it shows everybody that is relevant to who this has been talked about, agreed upon, and then you have the physician's name and information down here, followed by some signatures, and then some HIPAA disclosures here. All right, and then there's some review dates that go on through here. So that is what the North Carolina most form is. This is also called, and you will see this on a test. You're not really going to see an NC most form, all right, on a test. That's not going to happen. Maybe the state test, I don't know. But you will see this called an advanced directive. Okay, that is what this type of request is called. It is an advanced directive. All right, so the last thing that I want to show you is, obviously Captain Mackey did tell me, that y'all went over, um, scope of practice, standard of care, right? So standard of care is what a competent, EMT would do, right? That's where there's some sort of lawsuit or something. They're calling in an expert witness, right? So say me, I have nothing to do with this case other than I've been, paid by either the defense or the plaintiff to come in and they're going to ask me questions about how I would handle this under oath. And I say that, you know, that is what like the standard of care, how it gets defined. It's also defined through what the protocols require to be done and things like that. So you may be asking, well, what about these protocols? Let's take a look at this right here. So this is a protocol algorithm and it shows you how to read North Carolina's protocols. Okay, so here's what you'll see. Right here at the top, it's going to be the name of the protocol that you're looking at. Down here, it's going to show in this box specific relevant like history bullet points that have to do with this right here. All right. It's going to have any specific signs and symptoms that have to do with that protocol. And then also other diseases or injuries or just things you should be considering that might look like this, but it actually isn't. That's what a differential is. Okay, over here, if you see it in a black box, this is going to be, important information of some type. All right, right here, this particular box here is going to be a universal patient care protocol. So this is where we would come in and all of these protocols are going to start with this right here. So this is your universal patient care protocol. So it is a flowchart that explains everything that you're going to do in a like meta 30,000 foot view of how you're going to do it. Anything in a red box is going to be critical information, or it could say, hey, you've made it to this point of the protocol, but now we really need you to worry about something else, so go to this other protocol. This green box is whenever you may be making that movement back and forth between protocols. There you go. Indicates entry exit from or to another protocol. All right, this right here, this little icon, it could show that there's like a mini protocol within a protocol. Again, information boxes, and this type of box right here is where you're making a decision. Okay, so let's look at it right here. Scene safe? No, here. Yes, here. All right, you see the square box? All of this is information. Okay, red box, important stuff. All right, another decision. Is this medical? I hate that they put medical here, but they put it on this side. Or is this trauma? Okay. Now, what's our mechanism of injury? What's our mental status? Responsive, unresponsive, so on. More information. Okay. Now, exiting to different protocols as we come from this. That's how these work, but you can see that they are like this for a chest pain. Okay. And so it has the same thing. Information boxes, decision boxes, history, differentials, all of these different things, okay? So come down here, there's some other medications to look at. So that purple shading box, these are things that have been changed specifically for like Guilford County, stuff like that. And these protocols that I'm going to give you are Guilford County specific. So you can see this purple box here has some Guilford County specific stuff in it, right? And then right here is our algorithm legend. So when you're reading these protocols, we're going to come back here to the chest pain. Look here. You got a B. What does B mean? Emergency medical technician. That's what I'm training you for. So you can do anything in B, and this blank box right here is for EMR, emergency medical responder. We talked about that on Thursday. You can do anything with the B and anything that's blank. So here in chest pain, these are what you're doing right through here. But look here, you got an A and a P. Advanced AMT and paramedic. All right, and then Pearls, this is a low-key, some of the best information you can get about this stuff, the second or sometimes third pages of protocols. All right, so it has system-specific notes, see? That purple color, this comes from our medical director. This is part of the protocol. These are the rule. Anything that is in red is considered a key performance indicator, and that is a really important thing that you knock out. So if you look up here, identifying a acute myocardial infarction or a ST elevated myocardial infarction, AE or IE heart attack, is going to be a key performance indicator. Also, getting a 12 lead done, as well as giving them aspirin, is going to be really important to get done. Additionally, in the Pearls, you have just some other good information here, all right? Talking about different drugs, things that are specific to EMTs to think about. All of this stuff is super important. So I wanted to give you just a quick overview of how these works. And then as we go throughout the class, we will be, I'm going to be giving you more protocol information about specific things that we're learning. Okay, so that's it for the legal and ethical review that I wanted to give you. We're going to do a quick little review activity on Tuesday morning, but I need you, if you have questions, try to talk to your classmates or use your book, whatever you got to do to try to answer it yourself. If you still have a lot of confusion, bring it up to me Tuesday morning, okay? We really got to be careful with how many questions and time that we're spending with a bunch of these small questions that, we could just kind of, quickly look up in a book or things like that. All right. So there'll be another one coming out later on tonight, probably about communications and documentation.